guys, welcome to the video. It's Larry Bryan here. This video is gonna be the lame lung video. I was tagged in this over a month ago by Bailey and Vincent. It's a video regarding questions for all CF patients and how they do things differently. So it should be interesting. It's similar to the cystic fibrosis tag video you guys saw. But the first priority is why I haven't freaking gotten to this video in a month. Our house has been shaken with illness. Jenny has, we think, mono. But yeah, she was sick for a few days last week, which got me sick, we think, or she blames on me. But we were both sick. And mine only lasted 3 days, so that's pretty crazy. Normally it takes a week or two for me to get over even a cold. But I post on Instagram. If you guys don't follow me, it's at Defy to Breathe on Instagram. That's exactly what I did. My clinic wouldn't give me antibiotics because I was growing a lot of pseudomonas and it was resistant to the normal antibiotics they would use, which is Levaquin and Cipro. So instead, I used the essential oils. This is my on month for Caiston, and I just did my treatments, really consistent and thoroughly. So somehow I got over it. Pretty amazed. That's awesome. Hopefully this is the new way I handle sickness or colds. Also, we're thinking about moving, and we've been dealing with that, and we might have a move soon on video. Not sure, but I might need to show you guys this house before we move, so that way you actually see what it looks like compared to the house that we might move into. So anyway, we'll see. But on top of that, poor little Ralphie, big Ralphie, has an ear infection. So we've all been sick, and on top of that, I've had a lot of app projects. Mainly the CF app, which I can't wait to share with you guys exactly what it's going to look like, which should be maybe next week. It's getting pretty close to being finished, the update that I'm doing. All about a social section, so that's cool. Anyway, so Shinny's going to be reading the questions to me, so that way it's spontaneous reaction. Question number 1. Alright, so the first question is,
how do you keep track of your meds and treatments?
Alright, so how do I keep track of my meds and treatments? This would be me shooting myself in the foot if I did not share with you guys, of course, my CF app. What I normally do is I wake up every day and I have my pill container for the week. I have tons of these in a drawer that I've already preloaded. So each week I grab one of these and I take this every morning. Besides that, I take my treatments every morning, so that's easy to remember. And then at night, I take my treatments again. But throughout the day, I take enzymes with my meals, and I, of course, remember that because when I was a kid, if I didn't, I had all the stomach aches, and that taught me to learn. But other than that, I take, Aquadeck. I tend to forget that every morning and night. I forget Orkambi. That's pre-packaged in separate packages, so I have to remember that. Another one is Spiriva. I'm on Spiriva now, and that's new, so it's hard to remember that as well. But, so the way I remember them is if they're not in the pill package, and if they're not part of my morning treatments, then I go to my CF app, and I go over to my reminders, down here. Oh, it's not in focus, I don't think.
Get your face out.
Oh, there it is. So reminders, allow notifications. So you see like Orkambi, my nighttime dose, Aquadeck, my nighttime dose, Orkambi, my morning dose, Aquadeck, my morning dose, and Spiriva is my morning dose. So I don't know if you guys do this, but Aquadeck, I take one pill at night, one pill in the morning instead of both pills at once. The clinic kind of told me that little trick. It really helps us spread the nutrients throughout the day, the vitamins and stuff. But yeah, so this is what I use, guys. It's pretty handy. This is the app I made. It's called My Fight Against Cystic Fibrosis. It's for iPhone. We're working on getting the Android version. But yeah, so that's kind of how I just keep track of all my meds and treatments. It's pretty useful, pretty easy. And luckily I don't have to worry about insulin or anything like that, like I used to have to worry about. So it's no worries. Next question is...
what is your personal baseline?
What's my personal baseline? Another app feature. This is great, Bailey. Thank you for asking these because it really helps me show my app out. But so again, I go in the app. I go to menu over here, and let's see if I can do this on the screen. Oh wait, where's that? History. My history. All right, and there's me, my pretty little face. Go to PFTs, and here's my PFTs. And as you can see, my baseline. I log every PFT. So after I finish a PFT, I just log in the app, and then it will give me my baseline, which is the average right there. So my baseline is 42%. And yeah, that's just how I track my baseline after every PFT I do at the clinic. Log it, and I think I have it set to where after the last 3 PFTs you've done, so that way it's not, if you've done them over the past 6 months, it will at least give you your average for that 6 months, past 3 PFTs. So my baseline's 42%, and that is raised a lot since last year. I don't mean to brag again, but you guys have seen my previous videos about how low it used to be. I think like 28-30%. So that's it. Next question.
What do you do for lung clearance?
What do I do for lung clearance? Can you throw me the cornet? So for lung clearance, of course, I exercise. I go to the gym every day, 5 days a week. But besides that, I use the cornet. You guys have seen my airway clearance video maybe, or other videos I've done. But I love the cornet. This thing is freaking awesome. And it works just like the acapella. A lot of people are familiar with the acapella. Except it has more resistance, I feel like, than the acapella. And it's way easier to clean. All these parts, they come off. This is just a handle. But, they come off like this. And this has a little sleeve. By the way, I should probably blow into it for you so you know what it sounds like. It sounds crazy. So that's the cornet. And I do that 2 to 3 times a day. And I will blow into it like 10 times. I call it reps, but 10 reps. And I do 3 sets. So I do 10. I cough all I can. I wait maybe a minute, minute and a half, 2 minutes. And I do 10 more. And then, repeat until I get to 3. But yeah, it's really easy to take apart, and I just boil it in the, this is the sleeve. That's actually what makes the resistance. But I just boil it on the stove, and it gets clean. So that's what I do for airway clearance, and that's really the only thing I do. I have the acapella, I have the vest, I have the Aerobica, and unless I'm sick, like really sick, or I don't feel like blowing into it, I might use my vest. I haven't done that in probably a year's time. Otherwise, I just use the cornet. If I don't have that, I usually bring an Aerobica on my trips if I go anywhere, just in case I forget the cornet or the cornet stops working. So Aerobica, cornet, acapella, the handheld devices are what I like.
What is your least favorite type of cough?
Least favorite type of cough. So this is funny because a few nights ago I was coughing all night long, but it was my favorite type of cough. So like I kind of enjoyed it because it doesn't happen that often. But my favorite type of cough is the cough that you just, like, it's like almost like clearing your throat, like like that, but like it's productive, and afterwards you just feel open. Like that's my favorite type. So my least favorite type is definitely the coughs that either, one, the dry coughs that like I just can't get rid of. Like it's a tickle in my throat, and it's like several coughing fits over and over and over. And I don't know what brings them on, but I mean, Jenny's been with me when I had these days where it's like, we'll be running errands, and literally every 30 seconds, maybe minute, I have little tiny coughing fits. And I just can't stop it. And they're not really that productive. Like, I might cough stuff up, but I never feel clear. I just feel so, like, congested, and it just doesn't stop. But anyway, that's the cough I hate the most. It's so annoying. Next question, Jenny.
What other organs are impacted and how?
What other organs are impacted and how? Everything. I just hate everything about cystic fibrosis. Pancreas, obviously. I need enzymes to digest food. And also, I take Januvia for impaired blood sugars, and that has to do with pancreas and insulin. But besides that, luckily, not really much else. My sinuses are really bad, so that's affected. I've had 7 sinus surgeries, and luckily, since my 7th surgery, which was in March, and now it's November, I haven't had any issues, pain here and there, but nothing really bad. But yeah, that's about it. Luckily, I don't have the GI issues that a lot of CF patients have. I actually have a extended family member or something like that they have CF only in like their liver, a little bit in their lungs, but like mainly the liver. So luckily I don't have that either. But yeah, mine's just the lungs and the sinuses, and of course with most CF patients, the pancreas, as I have to take enzymes to digest food, and my blood sugars are impaired because of the insulin and the pancreas, the way they work. That's that question. Do we have any more?
What's your favorite food?
That's one of them? It's not even one of them. My favorite food, though, is catfish or crappie fish, but pond-raised fish. Fried.
That was it.
Golden fried. That's it.
That's all the questions.
That's all the questions. No more. So, that's it for my lame lung video. That's the questions. I hope that helps you guys out, or at least gives you an idea of how I manage my CF. And awesome, once again, that I got to show the app off and the features, and that's exactly why I made it, was because most of these things that we deal with on a daily basis as CF patients, it helps. Like, that was my goal, is to where literally you can incorporate the app every day in helping you better your health with CF. So that's awesome that that actually worked out that way. Thanks, Bailey, for tagging me in this video. Sorry it took me a month to do. I will explain in future videos on what I've been working on and why it's taking so long to do these videos. I just haven't been able to focus all my energy on my vlogs, unfortunately. But yeah, guys, as always, continue to email me with questions or suggestions for videos. Thanks for the comments. Thanks for the emails. Thanks for the likes and the subscriptions. And I'm going to go ahead and tag the Fry Life if they haven't already done it. Like I said, I'm behind the game on this one. And Hannah Breeze. Hannah Breeze tagged me in her other video. So tag Hannah Breeze, Fry Life, do a lame lung video. Don't wait a month like I did. But yeah, that's it, guys. Thanks for listening, and I will talk to you later. Bye.